Hello, my name is Harshal, bringing you another set of questions for you to practice. If you're someone who's preparing for medical coding certification or someone who is just a medical coding profession and want to brush up their skills. Right, there you go, sharing my screen, and you have your question on your screen. According to ICD 10 CM guidelines, what is the correct definition of an adverse effect of a drug? All right, shouldn't take more than a minute to this question. Last 30 seconds, and I'll reveal the answer to this question. All right, the correct answer to this question is option B. Always adverse effect will be principal diagnosis, and T series code will be your secondary ICT code. All right, moving on to next question. In which position should you sequence a manifestation code in brackets? All right, the correct answer to this question is option D, that is secondary code should be manifestation and primary code is the underlying condition. Moving on to next question, which of the following is a true statement regarding an exclude to note? A true statement, all right? That's what is being asked here. A truth is statement. All right, 30 seconds more. All right, the correct answer to this question is option C, that is not included here. Moving on to next one. 45-year-old female presents to clinic today for polyneuropathy and type 2 diabetes mellitus. She states that she checks her blood sugars regularly and the physician reissued the same medications, which is the correct ICD-10 CM code. All right, the correct answer to this question, since patient had type 2 diabetes with polyneuropathy, So when you lead the code, you will get polyneuropathy as a complication while leading into diabetes mellitus. So there you go. You have a combination code, better code, I would say. You have option C as your answer. That is E1142. Moving on to the next one. A 40-year-old was frying when an explosion of the oil occurred, and she sustained second degree burns on her chin, that is 2%, and third degree burns on the left hand, 5%. There was a total of 19% of the body surface burned. Select the ICD-10 CM code reported. There you go. There's a bit tricky question. It's not as complicated as it looks like. A bit of more time to solve that question. Should have got an answer by now. You'll only get an answer from within the options and not lead the code directly. All right, the correct answer to this question is option B. That is T23302A, 31310, and 321T2121XA. There you go. Moving on to the next question. A patient is seen for, you know what? I should have done this before. I should have done this before. I'm really sorry. A patient is seen for bilateral pressure ulcers of the buttocks and elbows. The pressure ulcers on the elbows are documented as partial thickness skin, lost into dermis. The pressure ulcers on the buttocks are documented as full thickness skin loss with necrosis into subcutaneous tissue. All right, I'll remind you again, they have mentioned partial thickness for the skin on the elbows and full thickness skin on the buttocks. All right, there you go. You'll be able to find the answer very quickly on those hints. All right, one more minute to solve that question. All right, I think anyways, few of them have got this answer already. Why not just go ahead of 30, 40 seconds and yeah, you'll get your answer there. All right, the correct answer to this question is option B, that is L89313, L89323. All right, I think with these two ICD codes, you've blocked your answer right among the four options. Moving on to the next one, a patient is diagnosed with impending myocardial infarction. How should the diagnosis be coded? All right, this is a bit tricky question. Please make sure you don't miss out on anything while looking up the codes. A very tricky question. If you think you have got the answer by choosing one of them from the four options or directly by tabular list, why don't you give it a try by reading the code from the alphabetical index? You may find something interesting there. Correct. The correct answer to this question, if you have laid it from the alphabetical index, you correctly get the answer. And also, if you missed out on looking something in the tabular, you'll get it wrong. Obviously, the answer to this question is CI20.0, probably something called unstable. And as such, I'm not sure the code description. I don't really remember as of now. All right, there you go. This is your answer, I20.0. Moving on to the next one. A 74-year-old male with Alzheimer's disease wandered away from his daughter's home. His dementia has worsened for the past several months. He was found disoriented and had a laceration on his right forearm requiring 10 stitches. What codes would be reported in this case? There you go. Should be easy again. I think by now you might have got the answer. If you have got the answer, why not, move ahead to forward it to more than the 20, 30 seconds. Yeah, around that. Right. The correct answer to this question is option B. That is G309 F0280, and the last code would be 811A. Right. Moving on to second last question. A 10-month-old infant was admitted for surgery for a right-sided, incomplete cleft lip and palate. Surgery was performed for both deformities. What codes would be reported? For more such content on your practicing, if you're preparing for something on a certification for medical coding, let me know in the comments if you're looking for something in particular. And also, why not subscribe, and why not give a like to this video as well, and for others as well. I know you have watched plenty of practicing videos. All right. And also let me know in the comments of how do you feel about the practicing content I've been putting out. Does it need? I meant give me a feedback. I mean, if it's worth it, if it's not, what can be else be done? Uh, can few things be changed? You want me to not switch on my video, keep it off? You can tell me that as well. If you've got the answer for this question, why not move on to the next question as well? The correct answer to this question is option B, Q378. Moving on to the last question. What is the correct ICD 10 cm code for malignant hypertension with stage 3 chronic kidney disease? Should be a way easy one for this one. All right, answer to this question is option D, because you have chronic kidney disease stage 3. That means option A and D are the ones appropriate. So B and C is eliminated. Since hypertension and CKD has a combination code, there you go. The combination is I12.9. So that is why option D is your right answer. All right. If you like what I'm doing, please give it a like, subscribe to this channel. Please leave some comment. That's ways I can reach to more people. Uh, this might help somebody else as well, just like you. And yeah, thanks for watching. I'll meet you in the next one. Bye.